is Abdalis Frias. I'm a fourth-year medical student from Universidad Autónoma de Guadalajara. Working with me is Dr. Kirk Thorpe, Dr. Neha Khan, and Dr. Michael Castro from the Abrazo Health Internal Medicine Residency Program in Phoenix, Arizona. I will be presenting on modern-day scurvy. Despite widespread availability of enriched and fortified food products, scurvy cases continue to occur. Symptoms will occur when vitamin C intake falls below 10 milligrams per day for 3 months. The clinical manifestations include lethargy, myalgias, pruritic lesions, most commonly affecting the lower extremities, as well as inflamed gums that bleed from little provocation. In this case, we have a 31-year-old male with schizophrenia who presented to the emergency department with non-traumatic leg ecchymosis with bleeding gums. The only medication the patient reports using is paliperidone injections. When questioned about his diet, he reports only eating Pop-Tarts and canned tuna fish for the past year due to his living conditions. On physical exam, he was found to have hemorrhagic gingival hypertrophy with confluent ecchymotic patches in the lower extremities. He also had curly brittle hair with scattered areas of hair loss in his limbs. Pedal pulses were present, +3 bilaterally, and the patient reported calf tenderness on palpation. Under diagnostics, his hemoglobin was of 6.5 grams per deciliter, hematocrit was 18.9% with elevated red cell distribution, and his platelet count was 184 times 10 to the 9th. Ultrasound done ruled out DVT. CT of the abdomen and pelvis were negative for acute hemorrhage, and urinalysis drug screen was negative. Hematologic workup included testing of anti-nuclear antibody, iron, B12, folate, von Willebrand factor antigen and activity, fibrinogen, factor VIII activity, thromboelastography amplitude, and coalin, all within normal limits. Discussion. In our patient, scurvy was a diagnosis of exclusion. Per patient's history and x-rays, trauma was eliminated. The patient's medication list did not include antiplatelets or antithrombotic agents or any drug that would cause petechia or purpura as an adverse reaction, nor a hypersensitivity. The patient's platelet count was within normal limits, and so was the hemoglobin, indirect bilirubin, reticulocyte count, LDH, serum creatinine, making thrombotic thrombocytic purpura and hemolytic uremic syndrome unlikely. As mentioned earlier, hematology workup was negative for collagen vascular disease as well as an acquired coagulopathy or thrombophilia, and a presumptive diagnosis of scurvy was made. The patient was treated empirically with 500 milligrams of ascorbic acid twice daily. The photographs were taken on day 3 of admission, and the patient's ascorbic acid levels were drawn 5 days after administering vitamin C. At this point, vitamin C levels were 1.1. However, previous human scurvy studies demonstrated that ascorbic acid is repleted rapidly after giving 66.5 mg per day of vitamin C. To conclude, although easily treated, the diagnosis of scurvy can be challenging due to its low incidence. Scurvy should be considered in nutritionally depleted patients presenting with spontaneous gingival bleeding, muscular aches, and limb ecchymosis. Patients considered high risk of nutritional deficiencies include those with eating disorders, psychiatric illness, alcohol abuse, homelessness, institutionalized elderly, and children with particular eating habits. In closing, diagnosis of scurvy should be made with thorough history, physical exam, and in addition to laboratory findings. Thank you very much.